Good afternoon, everyone. Thank you so much for joining us this afternoon for another episode of the Together We Heal Forum, brought to you by Integral Care and Central Texas African American Family Support Conference. The conference seeks to educate the African American community on mental health, substance use disorders, and intellectual and developmental disabilities. We hope this forum will provide the opportunity for you to participate in conversations that offer education, encouragement, and resources. So now let's talk about some housekeeping rules to help all of us. Please keep your audio muted at all times. There will be time for interactions. That is when you can raise your hand and I can call you to speak on live, or you can also put all your comments and questions in the chat. We'll get to that. Now, we are talking about mental health, substance use, and intellectual disabilities. So it's possible you might get triggered or overwhelmed or emotional. When that happens, please turn off your video and handle your emotions privately. But if you need to talk to someone, you can always call the Integral Care Hotline at 512-472-4357. Now, note that this is being recorded and streaming live on Facebook, so please smile. Today's conversation is on faith and mental health, Islamic perspectives. And our guests are Imam Khalid Shahid. We had a pleasure of speaking with him during our 22nd conference. He wears many hats in the community. He is a steering committee member of the Muslim Alliance with Black Lives. He's a board member of the Taqwa Ministries. He is one of the founding members of North Texas Islamic Council. This is my personal favorite. He is the first imam to perform the invocation for the inauguration of a newly elected mayor in Dallas. That is in the city's 178 years in existence. And then he recently became the Imam Emeritus of Dallas Masjid al-Islam, the oldest mosque in the Dallas area. Imam Khalid, thank you so much for being here. The next guest is Dr. Shiza Mosi. She is a CEO and Executive Director of Muslim Community Center for Human Services. She's also the Executive Coach and Relationship Expert and a Human Resources Consultant in private practice, focused on working with multicultural leaders and their families. Again, thank you, Dr. Motin. Latifa Hamid, looking pretty in purple. She is also the CEO of American Muslim. She's also a certified life and relationship coach, a certified domestic abuse awareness trainer, a self-talk trainer, author, poet, educator, and motivational speaker. She started Healthy Positive Choices in 2007, and that's a nonprofit organization which is used as a preventive tool to educate teens and young adults on the dangers of domestic violence while advocating for healthy relationships. Welcome, everyone, and I appreciate you all for being here. Now let's dive in. Our first question, let's talk about mental health in the Islamic community. What does a good book say about mental health, well-being? Imam Khalid, will start with you.
Thank you. I want to commend you for taking on this topic. And I'm very happy to work with this association again. This is something we need to talk about, because when it comes to mental health, we are in an outright crisis. And I don't say that lightly. We are in a crisis, not just in the Black community. We're in a crisis in America. You look at what's going on in America, there's a crisis out there. So we need to talk about this and share ideas and stuff like that. That's how you learn. You learn from sharing ideas from other people. So I commend you. This is something that's really, really big time that's needed today. So I commend you. We need to do this more often about mental health and all that stuff. But anyway, in terms of the Quran, the Quran tells us that God is the most merciful. It also tells us that God is Elebater, which is he is the source of all goodness. That he is Nafi, he's the benefactor. All your benefits come from God. That he is Nasser, he is the help. He provides all the help. And what does that mean? That means that any good you see and the help you get, all that stuff, all mercy comes from God. I'll give you an example. Any of this in the world comes from God. In the animal kingdom, if you see a cow nursing its calves, that mercy is not coming from that cow, that mother cow. That mercy is coming through that mother cow, but it's actually coming from God Almighty. It comes through. Likewise, with human beings, any help we receive, any benefits we receive from medicine, from counseling, from seeing professional people, don't come from those people. No, don't come from medicine. We're people of faith. It comes through God, but it comes from God, but it comes through the medicine and through professional people, through counselors. And does that mean that your help for mental illness and stuff like that going to appear in thin air? No, that's not what that means. Quran said, human beings, man gets only what he strives for. And if you don't, the Quran, another verse of Quran, if you don't know, you ask those who do know. So you have to go to the right sources to get the right help, but keep in mind it comes from God. The Prophet Muhammad, peace be upon him, he said this, I think it's very interesting. He said that, O servant of God, he said, seek cures. He said that that God has made a cure for all ailments that he has allowed. There's a cure out there for all ailments. Seek cures. As Muslims, we've been seeking cures going back to the 9th century. There was a Muslim man named Al-Kindi. He wrote a book in the 9th century about depression. The name of the book was on Dreams and Sorrow in the 9th century. Another man named Abu Zayd Baki, he developed therapies and medicine to deal with mental illness and mental and emotional illnesses in the 9th century. Ibn Sina wrote the manual of medicine that Europe used for centuries. He wrote extensively about psychology. These were all science. So as Muslims, we've never had a problem with science. None whatsoever. None whatsoever at all, y'all. So just to mention some things that come from our religion in terms of mental health. And let me mention this one other thing. Muslims developed a hospital called Dar Shif. These hospitals, going back to the 9th century, they extended from West Africa through Islamic Spain, through the Middle East, through Asia and the Far East. And these hospitals developed a wing. This was the first of its kind. This wing was developed just to handle mental and emotional illnesses. So in terms of science and using science to deal with these issues of mental health, that's our legacy. We've been doing this for a long time.
Well, thank you very much. Dr. Mohsin, what can you add to that? We've been educated very well.
Thank you so much, Dr. Aqua and Ms. Haneen and Imam Khalid, for the pleasure of being here with you. I am just, I'm getting goosebumps because this is such an important topic that needs attention. And, you know, it's music to my ears that it's getting the attention that it deserves. I think Dr. Aqua, what's important to understand is the challenge. And as Imam Khalid rightly said, this is a global, and especially within the US, it's a crisis that we're dealing with in all communities. But what is compounding it for the Muslim community is that, you know, and other minority communities, is that when you are dealing with mental health and stigma, and then you are compounded with elements of systemic racism, when it's compounded with elements of misunderstanding, when it's compounded with elements of Islamophobia, it just becomes even more heightened and a bigger crisis, in my view. So for the Muslim community, understanding that Islam is a very progressive religion that is very open to learning. Now, where we get challenged is when religion and culture get misunderstood. And a lot of times, Islamic interpretations are misunderstood because of the communities that are presenting that interpretation of the religion. So, in my view, there are almost, and I could be wrong, there must be more, that I know of, almost 80 different countries, Islamic cultures are represented in the US. Now, when you look at Islamic culture, you are looking at modified interpretations and how the religion is presented. So when you meet an Ethiopian Muslim versus when you meet a Sudanese Muslim versus when you meet, an African-American Black identifying Muslim, there is a cultural difference that's also playing a role. And so a lot of times the religion gets confused with the culture, which makes the challenge, the misunderstanding, the openness to seeking help even more challenging. So the religion is progressive and very open to getting help. Sometimes cultures come in the way. And that really, really makes it a bigger challenge for our teens, for our adults, for our women, and even for our men. So this is a very complicated scenario that we really need to start paying attention to untangle and understand.
Thank you. Thank you for that caveat. Latifa, anything to add? Oh, you are on mute. Latifa, you're on mute.
I forgot to take
There
myself
you
off.
go.
Thank you for having me, and it is indeed my pleasure. I appreciate all that everyone has said thus far. It is really, I mean, you hit it right on the nail with the Dr. Wright with talking about the various cultures, and sometimes we do get it intertwined into the religion. We'll take the culture and we'll do the culture instead of the religion, and it just gets kind of jumbled up in there sometime. Just wanted to give you all to start hadith, which is the sayings of the prophet, peace be upon him. One day the prophet, sallallahu alaihi wasallam, which peace of God be upon him, was sitting with his companions, and a person walked by and they called him crazy. Majnun. Then he said to them, don't call him crazy. He is under a test from his Lord. Shall I tell you who the real crazy ones are? They are the ones who have all their physical and mental capacities and don't utilize them. Even in his time, he was trying to take the stigma off of mental health. And we know there's a problem. People are under a test, and the stigma has been put on them. So we put stigmas on all handicaps. And if we follow the logic of the prophets, peace be upon him, a blind man, we look at all these people that are under a test. A blind man is under a test from his Lord, a person who can't hear, a person who can't see, and also a person that has mental illness. But it has improved somewhat, a lot over the decades, but it also has people who need the care that has increased in itself. So if that has increased, that has also increased. Some people choose to seek the treatment or they quit because of the stigma. You may know something is wrong, but you quit because of the stigma. And that's what we do a lot of times. I know as Muslims, when we say, oh, we have a problem and we're going to talk about, going to the imam if they're qualified to do this. And sometimes they'll say, oh, just go read and go pray and then you'll be fine. And we don't realize that sometimes there's some physical things going on. There's some things that was mental health. There might have been something that was passed down from generation to generation. So we don't know. We have to take time to go back and look into these particular situations. And I know as African Americans, being African American, I know sometimes we shy away from those type of things, mainly because of the stigma associated with it. Oh, you seeing a counselor? What's wrong with you? You crazy? That type of thing. But we have to realize that this is a real problem. This is not something that just going to go away. It's something that has to be addressed, because if it isn't addressed, it will just continue to get worse and worse and worse as time goes on. I'll stop there.
Whoa, thank you, Latifa. You actually put me to my catapulted me to our next question. You know how, as religious people, our go-to is our religious leaders, the pastor, the imam, the leaders, and then we go pour our heart out to them. But almost like every time, it is the prescription of one, blame the devil, and if you are African, it's some ancestor or somebody responsible for that. And then there's a prescription of prayer and fasting. So I guess I should also direct this question to Imam Khalid. What is the imams or the leaders of the mosques doing in regard to this? Are they prescribing, fasting and praying, or are they providing some other resources for the congregation to, go and seek help when it comes to mental health?
I guess if you're a pastor, reverend, or imam, you get all the credit. You get all the blame too.
Of course.
I think it's interesting. I saw my father go through that. My father was a Baptist preacher. He get all the credit, and we get all the blame too. But look, it's a very good question. To be honest with you, I can only talk about my experiences. I've been imam here for 20 years, here in Dallas. Part of the imam council here in Dallas, and so forth. Now, when it comes to problems like that, seeking, just when you have problems, seeking prayer, seeking fast, something like that, to me, that comes more from the people as opposed to the imam. Now, I've had people, I'm gonna give you an example. Here recently, I was talking to a couple that came to me about some problems they had, marriage and so forth, and I referred them. They told me what was going on. This man was from West Africa. And he was putting water, he called it holy water, Zamzam water, under his bed, because he and his wife having a problem. In his closet, under his sink in the kitchen. And the lady was American. She's American. She came to me and said, "What is that voodoo stuff? Why?" She was so upset. Why is he doing that voodoo stuff? I told her this. This is after I referred him to a counselor. I told her this. I said, that has nothing to do with Islam. Those are customs that he's brought from West Africa that are outside of the fold of Islam. So Dr. Musa and Latifa are exactly right. We get intertwined customs. If people bring customs over here, they think there's Islam, and it's not. Putting holy water under your bed in your closet to run away the devil? Come on. That has nothing to do with Islam. Those are some customs that people have that come from different countries. So that has nothing to do with Islam. What we do, we refer people to those who do know. And that's what I've seen. If you're not qualified to deal with these problems, I've seen from the imams here in North Texas, like I said, I'm speaking from personal experiences, I've seen them refer to people like Dr. Musa and Latifa, who's done many workshops at my master. I refer many people to MCC, the organization Dr. Musa's over, for years. So I'll stop right there.
Thank you, Dr. Musa. What can you add?
So I was going to say that I think that we should definitely emphasize the importance. And I think this is something that you see across the monotheistic faiths in Islam, in Judaism, and Christianity. Leaders like Imam Khalid are not as commonly present. So that's the reality. I want to make sure that we realize the limitation. If it were up to me and I had some kind of magic or voodoo that Imam Khalid was talking about, I would clone him and put leaders like him in so many congregations. So being, I'm a licensed marriage and family therapist, as well as a licensed professional counselor in the state of Texas. And so I get referrals from some imams, and sometimes I will get referrals where imams have not understood their place, and it has escalated the situation. So leaders like Imam Khalid are definitely not very commonly available, but I would completely agree that religious leaders have a huge role to play, because we do go to the faith for our challenges. And so if our imam is endorsing mental health support, and if our imam is saying, and I'm sure Ms. Haneem has so many stories she can share, that domestic violence is not acceptable in the faith of Islam, that's a very powerful voice. That's male privilege. So what we have to understand is we're working with a minority community. We're working with the African American community. And, I know that this conference is there to support their needs. So we have to understand the compounding issues, and we have to promote and understand the limitation available. So absolutely, there's a huge role, because I have seen congregations like Imam Khalid's congregation be very open to mental health. I get invited to speak at congregations. I get invited to do workshops on behalf of the MCC, the Muslim Community Center, where there are imams who are not progressive in this way and open-minded to understanding where the religious limitation is, and where mental health and experts have to take over to help, is a reality we have to really, really, and it makes their job really hard as well, because the congregant wants to talk to Imam Khalid. The congregant doesn't want to talk to me. And then on top of it, we have the challenge of the woman. We have the challenge of the male privilege. So we have all of these compounding issues. And then you are looking at a stigmatized issue, and you're looking at a community that's already carrying the burden of so many other stereotypes and bigotry and prejudice. So there is a lot of compounding shame when it comes to dealing with mental illness. So that's the reality of it. But to your question, the religious leaders, in my view, have a huge responsibility to promote it. And I feel that Imam Khalid does a fantastic job. I wish we had more people like him as leaders in the community.
Indeed, I agree. We do need more leaders who are open-minded, who are progressive, and who understand the needs of the community with respect to mental health. Latifa, can you share some experiences from your field?
Yes, ma'am. I'm listening, and the doctor's right, because what ends up happening is sometimes you'll go to various imams, and if they're not open-minded to look at what is happening, you have to look at a person's behavior, and then they may come to them, but you may see certain things, and sometimes you'll say to them, because first of all, we don't want to, especially in the Muslim community, like you were saying about the domestic violence. That's something that's pushed under the rug. People don't want to deal with that. It's like the pink elephant. They see it, but they don't want to deal with it. Same with mental health. And when they see mental health, it's like a mark of weakness almost in the faith, because they're saying, if you believe in God, why are you having problems with mental health? Is something wrong with your character? You're not praying hard enough, or what's going on? Okay. People will say, they'll imply a person is not praying enough. You're not being grateful. You're not being thankful. Just go on and be thankful and be grateful. And see, sometimes when people do that, it kind of pushes people away. They don't want to do that. And they'll say, well, stop whining and be grateful, or just toughen up. Some people will just walk away and say, forget it. I'm not strong enough. So let me just go out here and just do whatever, because I'm not worthy. I'm not worthy for God to bless me. And I'm telling you, I've had a situation, and I'm just going to tell you, I've had a number of situations, but one situation that comes to my mind is one time I was, in a marriage, and then it was some domestic violence, and the man told me, he said, if he is not actually taking your money or cheating on you or doing this, then you need to just be quiet and just go on and just be grateful. And I'm saying, wow, because sometimes we don't want to see some of the imams, not all of them, they don't want to see that this is happening. So they close their minds to it. And then you have some that are open minded, like Imam Khalid, where they will refer you. Then you have some that just, oh, you need to go pray. All you need is Quran. And that's true, we need Quran. And that's true that we need Hadith. But by the same token, if somebody has some mental health issues, it's like telling a person, a child, to go to school and learn, and they haven't eaten that morning, and they don't have any clothes on their back to wear to school. They're cold, they're hungry. How are you going to tell a person to go and just learn without first addressing their needs? The Maslow hierarchy of needs. You got to satisfy one before you can get to the other. So they cannot, if they're having mental issues, how are they going to concentrate? They can pray in Allah subhanahu wa ta'ala. God, he'll have them to look, or he may bless them for somebody to come into their lives. But by the same token, they have to seek that help. They have to get that help first to be healthy in order to pray and, reverence God. Because how are you going to do that when you're so confused in your head? So I'll stop right there.
Latifa is on fire. Thank you. And we do need to hear some of these things. I'm very sure there are people out there who have all kinds of ideas. They would love to discuss, or they would even want to talk to somebody and share their experiences. But then they're also afraid of the stigma. Your own friends, your neighbors will look at you funny, like, how dare you? You have a house, you have a car, you have a job, suck it up. And people are going through all these things and they're not getting the help that they need. What we're trying to do here is to tell you there are resources in the community that are accessible to all of us. And if you need someone to talk to, if you're not feeling well, seek help. There is help. All right. Well, we've been talking about diversity and culture and religion all meshed up right now, but I want to focus on this. And this is for you, Dr. Mohsin. Let's talk about the diversity in the Islamic community in the US and how this impacts perspectives or attitudes towards mental health.
Thank you so much. So from a diversity perspective, and I'm sure people who are listening to this conference, you would know that African Americans make up about 20% of the Muslim population in the US. That's a huge population that we, in my view, are not paying as much attention to that we need to as a Muslim community. Then on top of it, even within that community, we have diversity in terms of the different cultures, especially African identifying cultures like Ethiopia, Sudan, Nigeria. You have a lot of Muslims from different countries that are there. When you are looking at diversity, the intersection of culture and religion plays a significant role in adding to the stigma of mental health. So, for example, of the 20% African Americans within the US, half of them are converts, which means that that percentage of population is also coming from a different faith, such as Christianity. Well, guess what? Stigma is very similar in that community as well. So that becomes part of the culture. So pray, just like Ms. Amin was saying, just pray. Your faith is weak, that those kinds of messaging coming up. And then also understanding the role of women. So a lot of these culturally are male-dominated cultures as well. So that may have nothing to do with Islam, but the culture is showing up. Male privilege shows up. And like Ms. Amin was saying, that to tell a woman that it is okay to get beaten up, but be grateful because you do not have income challenges. So this is coming from the socioeconomical challenges that the African American community has faced. So you do not have financial strain. Why would you strain your life and become financially strained when it's so much better if you just get beaten up a little and have a home and a roof under your shoulders, and you'll be fine. And I will tell you that from the other African identifying cultures, a huge component, and I want to bring it up because, a lot of times mental health and substance abuse is correlated with poverty. So it's very easy for us to judge that somebody is choosing to take drugs, but it's a coping mechanism. Being a mental health professional, we know that they're trying to numb something. And when you talk about the challenge of immigration, settling in a new community, anybody who will move from Ethiopia or Sudan or Nigeria or any of the other Caribbean countries and so forth, your socioeconomic level is going down significantly when you migrate. So that's compounding your issues. Your reality is changing. And if you don't have mental health support, then you are having further challenges, which will feed into the stereotype of the community. So then managing mental illness becomes even harder. So understanding diversity and understanding the challenge of the community, followed by the challenge of the faith. Another thing I want to point out in the diversity is when we come from male privileged cultures. So for example, in Nigeria, there is a huge male privilege present there. So if somebody from that culture, and I'm not pointing out Nigeria because that shows up in all of our cultures, minority cultures, if there's a male privilege, then it is okay for a man to beat their wife if they're not praying. If the person has mental illness, they're beating their wife black and blue. Islam does not support that. Islam, a belief can be taken out of context. Scripture can be taken out of context and hidden in that tension, in that pain. So we are not able to diagnose as much. And these are some of the challenges. I also want to point out, because I am working really hard at the MCC and also with other religious leaders to dilute the stigma around men and mental health. The male population is more isolated in many ways because it's very easy for us to blame and place blame on men in the community without giving them the help. So it is also something we must understand and recognize from a male-female culture. Women will still talk about their problems in the community. I don't know what Imam Khalid's experience is, but when a bunch of men get together, they talk about football and cricket and anything but real problems, or they will pretend like everything is so fine. So they are actually even more isolated in their problem, in their challenges, and they don't have anyone to talk to because it's considered not very masculine to have those kinds of problems. So when you're dealing with a diverse community, when you're dealing with a male who's come from a culture where he is the leader of the family, how can he have a problem? You're also dealing with multiple challenges for everyone in their family system. So diversity plays a huge role, and diversity is not just cultural diversity, a diversity in your family, your socioeconomics, diversity in age. Older people are more hesitant to take mental health help. The children want counseling, the parents won't allow it. So there's an age diversity component. So there are many, many folds and layers that I would really love for your audience to be aware of as they are noticing mental health challenges in this community. And I'll stop here.
Oh, thank you so much. If I saw you not, what
Yeah, I mean, she is so on it. She is so on it. Thank you. You're so on it. I mean, I've heard of people, where they would kill their children because, they come to this country and their daughters and their sons, they don't adhere to the culture more or less than the religion, and they'll kill their children. They shoot them up and kill. I mean, I've seen that so much from people from various cultures because they cross the culture with the religion. There's no compulsion in Islam. And so they'll say, oh, well, you're not following the way. It was not too long ago, man killed his two teenage, they were, I think their early 20s, because they were in this society, and this society, they felt they were going to go astray. Man just not too long ago in Houston, wait for his wife to come out and shot her down, shot the baby, killed himself. I mean, these were Muslims. So I'm saying we're not exempt from mental health. And we have mental health. And the more we realize that, we want to sweep it under the rug again. We don't want to acknowledge that. So thank you for sharing that. I can relate to that. I know in the Quran, in the English part, it says that a man can beat his wife lightly. I've heard a number of brothers say that you're gonna, this is my God-given right. I can beat you. Told me I can beat you because this is my God-given right. Misunderstanding this, and that's the English part. Doesn't say it in the Arabic part, because the Prophet sallallahu alaihi wasallam, peace be upon him, said that, he had like a mishwak, I guess, doing with your teeth, and sometimes, the hand or something like that. But these people are talking about beating somebody, physically beating them. I am, a survivor of domestic abuse, so I know about those type of things. And they were Muslim men. So I'm saying that's mental health issues, to think that you as a human being can beat another human being because you feel superior. And that's what they were feeling, superior to the women. Well, I'm better. Like you said, male dominant culture, we can't blame it all on them. But some cultures, the men are more dominant and the women are subservient in some cultures. But that's not Islam. People want to intertwine it with Islam. That's not Islam. And so I've had it. And speaking of the African American community, I think you hit it right on the head. A lot of us come from Christianity. Like you were saying, half of the 20% of the population are converts. And that is so true, because we come from another environment. See, we were somebody else before we came into Islam. So we came from these different cultures. And coming from these cultures, we have environment, come from a Christian background, a Christian environment. We try to come into Islam. It takes time to get through some of that. And some of those mental health issues, you bring those with you. And then you try to mix that with Islam. And then you have a mess. So really, I can say for myself, coming in to Islam, it was something that I never knew before. So when I came in, I was thinking, oh yeah, I'm going to change the world, so to speak. And I'm going to do this, I'm going to do that. So whenever I was in a marriage to a Muslim, I'm thinking that I'm supposed to be like this. I'm supposed to be like that. Oh, maybe I need to not say anything. I didn't know my rights. And so as you study, you're obligated as a Muslim to study on your own, to know your rights as a woman and a man. And then sometimes that mental health issues play in it. Like I said, all these different things, voodoo and all this stuff. So we have to really look at this and say, okay, is this some mental health issues? Maybe we need to go and see someone. Maybe we need to go and talk to someone. But we have to address these problems because they're running rampant. You can tell out in society, not even the Muslim, beyond the Muslim community, it's running rampant. And so we really, really have to do that. And thank you for bringing this forum out and starting this. This is so wonderful. And God bless you for this. Appreciate you. I'm gonna stop there.
Thank you. Imam Khalid, I see you have something to say.
Well, I'm just thinking, I'm glad all this is coming out. There's a book written by Dr. Joy DeGruy. The name of his book is post-traumatic slave syndrome.
Mhm.
And she wrote this book a decade ago. So one of the things she brings out in this book, she said that a lot of the violence you see among Black people, it has become a social pattern because that's what we experienced in slavery. We experienced a lot of violence, we were traumatized during slavery. We adopted a lot of those ways to deal with problems. One of the things she said that in this society, when we cannot get people to respect us, we get them to fear us. You're not gonna respect me as a Black man or Black person. I bet you I can make you fear me. So it's like in exchange for not having respect, you're gonna fear me then. So we make people fear us, we use violence and so forth. But she traces this back to being traumatized for 400 years in America. And when people are traumatized, they're hurt mentally, socially, psychologically, and those things play out in our lives, she says. So it's a good book by Dr. Joy DeGruy. It's called Post-Traumatic Slave Syndrome. We've heard of PTSD. People see a murder, they have PTSD. When we saw murders and people getting mutilated and all horrible things happen to them for 400 years in America, we developed a lot of social patterns. Those social patterns are still playing out today. They're passed from one generation to another generation. This is a great book.
Awesome conversations, but we need to be able to allow our attendees to also ask questions. So I will ask this last question, and it is if you have any resources to share. Any resources that you've been working with or that you know of, so that people listening to us and have similar issues can access those and get help. Dr. Mosi, you could go first.
There are so many resources. When you start looking, I feel that there are multiple resources. And if you would like, at the end of the live stream, I can post a few links. SAMHSA is a great organization that publishes a lot. When you are looking for local mental health resources, one of the things that I would recommend, because I want to be careful and supportive of the reality that we do not have as much a minority mental health professionals in the field. So when you are looking for help, what you want to do also is to look for culturally competent mental health professionals who will understand your culture, who will understand your faith belief, and you don't feel that either your mental health and counseling experience is a cultural orientation for your therapist or counselor, or you have to explain so many beliefs about yourself, and or you feel the compounded responsibility of explaining your ethnic, racial background to someone. So I'm just putting that out there, that resources, thank goodness, now are plenty. Finding culturally competent resources can sometimes be a challenge. So seek out organizations that will understand your community, that understand the cultural nuances, so you can focus on the mental health challenge. So what I'm happy to do, because there's so many, SAMHSA is a good one. You have the suicide prevention hotline. There are many organizations who are doing great work in supporting and educating us. And there is the state of Texas, if you're just looking at Texas, has a directory which is called 211. And when you look at it, you will find a lot of low-cost mental health services that are available in the community, in your respective communities, that you can really access based on where you are residing. That is really important. Right now, because of COVID, the dynamics of therapy and counseling have changed to where there are a lot more virtual options available. So when you Google, you will find a lot of resources. I would say when you are taking that step, do a little bit of homework before you make yourself vulnerable, because it's a very emotional experience and you want to feel supported and you want a trained professional to help you. And I'm happy to share a couple of resources at the end of our live stream that can be posted in the comment section.
Thank you very much. Latifa?
Yes, no, I can say when I have gone to, and I have seen various counselors, and one thing, and I'm kind of going on what the doctor is saying, I look for, when I look for a therapist, I always see the background. What is that person's background? What is their philosophy? What kind of treatment do they have in terms of what they believe in? I always look for all of that. I ask a lot of questions because you're right in saying that you just don't lend yourself to anybody. Because I feel like, okay, I'm an intelligent person, so I should look at this as though I'm looking for me a nice pair of shoes, a nice dress, or whatever I'm looking for. I want to put that in that category. I'm not so much saying that I'm going to look for that and just like, oh yeah, but I'm particular about who I lend myself to in terms of talking. I want to make sure that a person understands, like you said, my cultural background, understand that, what's happening with me, because I can explain what is going on. I just need that feedback, because all that counselor is going to do is listen to you and give you suggestions on different things. It's up to you as an individual to change yourself. So many times we go and we want someone to just, oh yeah, I want you to just take me and just change me. You gotta put the work in. You got to put the work in. They'll give you certain things to do, and you have to put that work in order to get better. You can't just think somebody's just going to zap and you get better. And that's what something, I'm not going to them no more because they didn't do anything for me. But you have to internalize those things, listen to that person, and make sure that this person is connecting with what's going on inside of you so that you can talk to the individual. And that's what I would suggest. And do your homework. Do your homework. Find out who this person is. Find out what some of the things that are going on with you. Write those down. Write down certain things. What triggers you in certain aspects, and when what happens to you. And so that's what I would suggest. And me being a coach and relationship coach and all of this has come from me getting help in certain areas and then giving back what I know, as a coach. So I'm just saying that these are just some of the things that I would put out there to the audience. Thank you.
Thank you, Latifa. Imam Khalid, you are muted.
You just quickly want to stress again, in order to understand how we got to where we are now, we see a lot of mental instability in society. Nothing exists in a vacuum. There's a historical context to everything that exists. So in order to understand now, this instability now, you have to study the historical context in order to have a proper understanding. Again, this book by Dr. Joy DeGruy is a very good book. She talks about the symptoms of a people that's been traumatized. People who have PTSD, they demonstrate certain symptoms. So she's talking about the symptoms of a people who've been traumatized for hundreds of years. We cannot ignore that. Those have become social patterns that families have adapted and passed on to their children. That has to be analyzed. That has to be considered. We cannot overlook that.
Thank you. And right at the heels of that, I had someone text me this question. And the question reads, how does Islamophobia affect the collective mental health of the Islamic community? I think it's a perfect segue to what you just said. How does Islamophobia affect the collective mental health of the Islamic community? Dr. Mosi, would you like to start?
Absolutely, I'm happy to. Islamophobia has a huge impact on the mental health of a Muslim community. It is very, similar lines to what you are maybe familiar with, called racial battle fatigue. When a community is stigmatized for something that is just adding to the definition of them, it impacts their resistance and their isolation in seeking help and help seeking behaviors. So for those of you who may be familiar with it, Islamophobia is something that Muslims have been impacted with a lot less before 9/11, but after 9/11, there was a huge stigma around anything that would be something that a radical group of people would do, that was blamed on the entire Muslim community. I have worked with children who were in high school at the time that 9/11 happened, and hearing comments and personally getting comments in my workplace at the time. So I can only imagine what others may have gone through of go back where you came from, and you are synonymously interchangeably used to be described. If you are a Muslim, then you must be a terrorist. Hearing stereotypes that, all Muslims are not terrorists, but all terrorists are Muslim. So all of these stereotypical information that, and negative information that has been fed. And I'm going to tie it to what Imam Khalid said recently a few minutes ago, that it has compounded the effect of trauma that somebody feels for defending their identity, their religious identity. So a lot of times when I can talk from a personal experience, because I think the Muslim community in general has so much to share in terms of Islamophobia having an impact, any negative behavior is then tied to the religion. A simple example I'll give you, I was talking to a group of attorneys and mental health experts who were asking me questions about Islam, and they shared with me a question saying, is Islam a rude culture and an impolite culture? Because I entered this store and there was this Muslim family and they didn't even make eye contact. I opened the door for them and they were so rude and they didn't even look at me, and they were they seemed so mean. So is that something that is encouraged in Islam? And I feel very fortunate that I was wearing my head right that evening when I was answering the question. And I said, first of all, I apologize for your experience. It sounded like they were really mean people. But it's so interesting that you would attach that to their faith. And so when somebody who is a Christian person or a Jewish person or a Buddhist person is making poor choices, would you say it's because they're Christian? And would you say it's because they are, Jewish or Buddhist or whatever their religious affiliation is? So what happens is a lot of times in help-seeking behaviors, for example, for domestic violence, if somebody who's not as brave as Miss Hameen is going to a counselor to talk about her husband beating herself up, she is so scared because it's going to feed the stereotype of men being misogynistic in the Muslim culture. So the fear that is inculcated about the religion and the religious followers compounds the situation. So Islamophobia is real. Pew Research did a survey and they found out that Muslims are hate crimed, not when something terrible is happening, and that was conducted by radicals around the world. So there have been some terrible atrocities that have happened. And you would imagine that when those terrible things happen, Muslims would get a backlash. Muslims get hate crimed around election time. That's the reality in the US, which means that the fear is fed, right? So it is so important to understand. Now, compound that Islamophobia with somebody being an African-American male who's Muslim. Can you imagine the stereotype around, if they may have a mental health problem or a drug abuse challenge they have to deal with? On top of it, if they're Muslim, that is going to feed into those stereotypes that have been really encouraged in society. So Islamophobia is real. The tension and pressure that surrounds Muslim men and women in being a minority, and on top of it, Muslim, is compounded and comes in the way of their help-seeking behavior. I'll stop there.
Thank you so much. We do have 5 minutes to close it. So if any one of you has something to add, I appreciate that. And the
Yeah,
audience, if anyone has a question, we will take it at this point. Yes,
just wanted to say, I mean, I agree with everything that the doctor was saying, because, you know, every time, especially with the Islamic, the phobia that we have, every time something happens overseas, has been escalated, they were terrorists, but they were Muslim. They always put that out there. And when you put that out there, people begin to lump all the stereotype, all Muslims, like she said, are terrorists. And so people began to look at them and begin to shy away, or thinking, oh wow, that person is a terrorist, so that person is going to do this person. So you fill your mind with all these negative stereotypes, and it's escalated, especially in a society, because the news media, that's where a lot of people get their news. So if they escalate that in the media, then what's going to happen is going to filter back out into the society and everyone else. So I think that it makes people paranoid. It makes Muslims paranoid. And so it really just happens to hurt all of us in the long run with having that. And it all starts from the media, because the media is the ones that get that information out. So just education and having an understanding of what is this, you know, and giving people more positive things about Muslims overall, so that they'll know this is not indicative of a Muslim. You have to separate that from being a Muslim. Islam it gets a bad name from various cultures, various groups, like you know, some of these groups that they have that are doing the bombing and the terrorism and things like that. So, all right, stop there.
Thank you. Imam Khalid, anything to add?
No, I think a lot been said. Again, great topic. I think we're all a happy part of this effort. So we again commend you, your association, for having us, and we thank you. Hopefully people learn something. And again, sharing is always good. It's always good to share from different cultures, different backgrounds. So hopefully we've done that today.
I believe we have. Thank you so much, Imam Khalid, Dr. Shiza Mohsin, and Latifa Hamid. I cannot tell you how much I appreciate you sharing your time with us and helping us carry on this conversation. People who attended this event, thank you so much. If you want to enjoy more of conversations like this, please join us every third Wednesday at 1:30 p.m. This forum is coming out of the Central Texas African American Family Support Conference. We are currently planning the 23rd anniversary conference, scheduled for February 7th to 8th, 2023. So please, if you're interested in hosting a workshop, go on to our website, www.ctaafsc.com, and submit a proposal. We also have opportunities to recognize people in the African American community who are helping improve lives for people living with mental health, substance use, and intellectual and developmental disabilities. So please, if you know anyone doing some great work out there, nominate them for an award. We are not talking about people who are spending billions to do this. It's the everyday person that we want to tell them we see them, we appreciate them, and we also want to urge them on. Now, to end this forum, I would like to say that there is help out there. There is help. If you have a headache, you want to see a doctor. If you have heart problems, you want to see a doctor. If you are broke, you want to talk about it. So why don't you want to talk about your mental health? Please seek help. There is help, there are resources abundant in the community. There are therapists and professionals from every cultural background. Please seek help. It's been my pleasure hosting this forum. Thank you, Latifa, Imam Khalid, Dr. Mosi. Thank you so much. And thank you all for joining us. Have a great day.
Thank you.
You too.
Thank you.
Thank you. God bless.
Thank you.
Thank you.
Bye, everyone.
Bye-bye.